Today it's great to be here as an intersex person to say that we are not invisible, we do exist, and intersex rights are human rights. For the opening remarks, I will be inviting Kirsti Kauppi, the Ambassador, Permanent Representant of Finland in Geneva. Thank you, Kirsti.
Thank you very much, and a very warm welcome also on my behalf, on behalf of the Finnish mission here in Geneva. First of all, a very warm welcome to my dear colleagues, the permanent representatives of Australia and Chile, and also representatives from other missions. I see at least India, Mexico, Netherlands, and I'm sure they are also South Africa. Great. Thank you for coming. And thank you to everybody. It's great to see such a turnout here. And I also, of course, want to thank especially ILGA International, who has been co-organizing this with us, and all the co-sponsors, Argentina, Austria, Australia, Chile, Iceland, India, Mexico. Am I missing something? I have 2 times Chile here, so very good. So this is great. The human rights of intersex persons have entered the Human Rights Council agenda quite recently, but there's quite a momentum on this issue. In 2020, at the 45th Human Rights Council session, a cross-regional group of 35 states, led by Austria and the Netherlands, delivered a joint statement calling on states to protect the human rights of intersex persons. A similar joint statement was delivered last year at the 48th Human Rights Council session, and 53 states co-sponsored this joint statement, so that also shows an increasing interest and commitment. In July 2021, also an important milestone, the African group introduced a statement on intersex issues and sports, and this has been an important contribution in raising awareness regarding human rights of intersex persons. Several human rights mechanisms, as well as UN agencies, have also expressed their concern on the impacts of the harmful practices intersex persons are subjected to. We hope that this side event will serve as a valuable next step to these important past efforts to increase awareness on what it is like to be an intersex person and how their human rights can be protected, promoted, and fulfilled better. We hope that this event will increase understanding also about the diversity under the intersex umbrella. Over 40 relevant genetic traits known, and most importantly, the multiple and intersecting forms of discrimination and human rights violations and abuses that intersex persons face in their daily lives. A few words about the context in Finland regarding human rights of intersex persons. The goals of Finland's international human rights policy, the eradication of discrimination and increased openness and inclusion, are mainstreamed into all of Finland's foreign policy activities. On a national level, the attention to the realization of human rights of intersex persons has increased in Finland in the past years. Monitoring and information about the situation of human rights of intersex persons has led to recommendations of new practices in the healthcare sector. But there is still much to do, as we will hear also today. One milestone in Finland was a study on the rights and experiences of intersex persons study commissioned in 2019 by the Ministry of Justice and Ministry of Foreign Affairs. And I'm very glad that the author of this study, Tikli Oikarinen, will be one of our panelists today. And finally, I want to introduce our esteemed keynote speaker and panelists. The keynote speech will be delivered by video by none other than Mr. Tlaleng Mofokeng, UN Special Rapporteur on the Right to Health. And our panelists are Morgan Carpenter, bioethicist and human rights advocate and Executive Director of Intersex Human Rights Australia, Michael von Gelderen, human rights expert at the IHRA, and as I mentioned, Tikli Oikarinen, who is Finnish expert and author of the study I mentioned. And the panel is moderated by the fabulous Christel Hendricks, who is a queer, intersex feminist, a human rights defender, and intersex program officer at Iranti. I look very much forward to the discussion and exchanging views and hearing best practices and experiences. And most importantly, I do really hope that these discussions continue to keep the issue on the agenda of the Human Rights Council, and that we can actually help improve the human rights situation of intersex persons on a global level. So thank you very much for coming, and I'm certain that this will be a very important discussion and also a very important step to further, as I said, strengthening our commitment to this issue. Thank you.
Thank you so much, Kirsti, Kauppi. I sense that some people are a bit nervous to clap. We are not at the UN buildings, so we're welcome to clap and really engage in the conversation. I would really like to thank Kirsti once again for those opening remarks, and I'll echo what you said. There is still much to do. There's still much to do for the intersex community to really shine light on what the intersex community is facing globally. We will now be playing a short video from Ms. Tlaleng Mofokeng, who is the UN Special Rapporteur on the Right to Health.
Excellencies, distinguished guests, colleagues, let me start by expressing my heartfelt gratitude to the Ambassador of Finland for this invitation to speak with you all today. As the UN Special Rapporteur on the Right to Health, but also as a medical doctor in clinical practice, this work holds great significance, and I'm honored to share some of my own insights on how the right to health of intersex persons and protection from violence and harmful practices based on sex characteristics. The right to health, as defined by the Committee on Economic, Social, and Cultural Rights, is an inclusive right extending not only to timely and appropriate healthcare, but also to the underlying determinants of health, such as access to health-related education and information, including on sexual and reproductive health. A further important aspect is the participation of the population in all health-related decision-making at the community, national, and international levels. Furthermore, the right to health is interrelated and indivisible and dependent on the realization of other human rights, including the rights to life, non-discrimination, equality, the prohibition against torture, privacy, access to information, and the freedoms of association. These and other rights and freedoms address integral components of the right to health. Most often, at birth, intersex people are subjected to unnecessary and unethical surgeries aimed at normalizing them through surgical interventions on their external genitalia, and later in life through hormones to fit neatly into an assumed sex and a gender binary. This is the beginning and sets the stage for a lifetime of violation in healthcare settings. Intersex anatomy doesn't always show up at birth, and sometimes a person isn't confirmed to have intersex anatomy until they reach the age of puberty or has fertility concerns. While intersex children and later as adults may face multiple problems, the most pressing for intersex children is the ongoing practice of intersex genital mutilation, which constitutes a significant human rights violation, and this must stop. The medical faculty must also confront its paternalistic and patriarchal practice of medicine. The medically flawed interventions are dehumanizing and constitute systemic and structural violence on intersex people. Healthcare workers must instead see the practice of medicine as a tool to protect human rights, especially of intersex people. Achieving the sustainable development goals, especially one on good health and well-being, is still an unrealistic ideal for intersex people. In many cases, when social progress is made, legislation and the practice of medicine continues to make human rights violations. The WHO indicates that sexual health is fundamental to the overall health and well-being of individuals, couples, and families, and to the social and economic development of communities and countries. Sexual health, when viewed affirmatively, requires a positive and respectful approach to sexuality and sexual relationships. It also requires the possibility of having pleasurable and safe sexual experiences, free of coercion, discrimination, and violence. Sexual health-related issues are wide-ranging and encompass sexual orientation and gender identity, sexual expression, relationships, and pleasure. And we can see how intersex persons' human rights to be protected is important. The challenges that stand between individuals and the enjoyment of sexual and reproductive health rights operate at different levels. In clinical care, at the level of health systems, and in the underlying determinants and social determinants of health. The key principles that shape human rights, especially non-discrimination, equality, and privacy, as well as integrity, autonomy, dignity, and well-being of individuals, especially in relation to sexual and reproductive health rights, are integral to the realization of the right to health. It has also been noted that international human rights law and standards do not spontaneously encourage custodians of the law to decide in favor of people in severely marginalized situations who experience multiple intersections of oppression and against people in positions of power or privilege. This provides motivation for national laws to be examined, not only for their protection of human rights, but also for their potential to pivot towards abuses of human rights. Dignity and bodily autonomy are central to the right to health, and therefore states have the obligation to adopt appropriate legislative, administrative, budgetary, judicial, promotional, and other measures to ensure the full realization of the rights to sexual and reproductive health. This, above all, should guide all engagement around issues of human rights related to intersex persons. As stated in my report to the Human Rights Council in June of 2022, I recalled that state parties' immediate obligations include guarantees of non-discrimination and equal treatment. And they also have an obligation to take deliberate steps, such as targeted steps and action towards the full realization of the right to health, as the preparation of a national public health strategy and a plan of action. And this must include the issues of human rights of intersex persons. The right to health also demands safeguarding of the bodily integrity of children and adults with intersex traits and providing protection from harmful practices, such as related to and impacting on their autonomy and sexual and reproductive health and mental health rights. Denying the dignity of individuals through criminalization, pathologization, stigmatization, unethical and unnecessary medical interventions diminishes self-worth, and in so doing prevents the realization of the right to health. To restore someone's dignity, you have to see them as fully human first. And many of our goals in global health systems are deeply dehumanizing. Autonomy is central to this because autonomy over yourself is freedom. And I want to urge all of us today to commit and recommit and to strategize in the different ways that we can protect, respect, and fulfill the rights of all people, including intersex people, and prevent and end violence, especially within healthcare settings that children and intersex adults experience. Thank you very much.
Is this one done? Thank you. Oh. One, two, there we go. Thank you so much for that really inspiring video from Dr. Mofokeng, and I believe that the Special Rapporteur really touched on everything that intersex people are facing. We are going to move over to the panel discussion, but before we start, I would just like to welcome Morgan Carpenter. And Morgan will just be giving us an introduction of what is intersex and what are some of the violations that intersex people face in the community.
Thank you so much. Would it be okay if we all came up? Just, or should I sit down as well? Hi, it's a real pleasure to be here, and I want to say thank you to Crystal for moderating, to the respected delegates distinguished guests from the different member states of the UN, and thank you all for being here and listening to us talk today. Intersex is a term, one of several different terms, umbrella terms for people with innate variations of sex characteristics that cause medicine and cause society to stigmatize the population as different. It's the way our bodies are perceived that causes stigmatization, maybe rather than anything that is inherent to having an intersex trait or variation. There are other terms that are used to describe people with intersex variations. There's clinical language such as disorders of sex development or differences of sex development. And many people, of course, most people have a specific diagnosis. And these diagnoses can have long Latin names or shorter descriptions. Sometimes they have the name of the clinician that discovered them, although such names are increasingly out of favor in medicine. And different people will choose different terminology based upon their experiences of stigma and misconceptions. And I want to say that we should be trying to respect and acknowledge the different language that people will use and the reasons why they will use that different language. So fundamentally, we're talking about physical traits, innate traits, traits that may not be visible at birth, but are evident, or that exist at birth and may become evident later in life. They include anatomical differences. They include atypical ways of producing or metabolizing or using androgens. And they may include sex chromosome variations as well. And these different traits can come with some different lived experiences. There can be a different typical age of diagnosis with different traits. There can be different healthcare needs. And in a few cases, this can include a need for access to early treatment to preserve life. What the people with these different traits share in common is a risk of stigmatization because we are seen to be different. And this includes risks and experiences of harm, of discrimination, of stigmatization and shame because of the way we are perceived. And these create particular risks in medical settings, often before we have age or agency to express our own values and preferences about how we want to be treated. These can include feminizing surgery. So, for example, in my country, there's been discussion in multiple places about young preschool children having surgery that would enhance the appearance of their female genitalia. We also see masculinizing surgery, which can include the suggestion, for example, that a boy who's unable to stand to urinate needs surgery to be able to urinate appropriately. And that word appropriately is doing a lot of work. There is also hormone treatment and a risk of sterilization in much of the population. And the population, we typically experience frequent medical examination from time of diagnosis, and that itself can produce experiences of trauma. Outside medicine, people can experience stigma, discrimination, and misconceptions, including ideas about who we should be, often ideas about what our identities should be. So, for example, many people with intersex variations, more than the general population, will grow up to express an LGBT identity. But many of us do not. Many people will grow up to be cisgender and heterosexual. And we want to encourage respect for all of these identities and not make assumptions about who we should be. In many places, people can struggle with access to sanitation or access to education. And in some particularly resource-poor settings, that there is a risk not only of medical treatment, if it's accessible, but also a risk of infanticide. So the intersex human rights movement has worked for 25 years to challenge these issues of stigmatization and harm, and to promote the health and human rights of people with innate variations of sex characteristics, irrespective of our identities, and try to make sure that everybody has the right to access treatment when we are able to express our own views and preferences about how or if we want treatment. So perhaps that's enough for now.
Yes. Thank you very much, Morgan. Thank you for your expertise. So on the panel today with Morgan Carpenter, we have Michael van Gelderen and Tikli Okarinen. They were already beautifully introduced by the ambassador. So Michael, I'm going to head over to you. In 2019, the OHCHR released the background note on intersex human rights. Could you share with the panel what were the main findings of the note and how does the current international human rights standards protect intersex persons?
Thanks so much, Crystal, and thank you to Finland and all the organizers and co-sponsors of this important side event. The UN Human Rights Office has had a dedicated focus on the human rights of intersex people for the past 7 years, and we're very happy to see increased attention from states to this important issue, including at the Human Rights Council. The background note and our other publications highlight a number of key points, and I'll try and summarize as best as I can in this time. First point is, I think it's already been highlighted, is that intersex persons face specific human rights violations based on their sex characteristics, and that this is a distinct ground that requires dedicated attention. The full range of United Nations human rights mechanisms, including the Committee Against Torture, the Committee on the Rights of the Child, the Committee on the Elimination of Discrimination Against Women, the Human Rights Committee, the Committee on Economic, Social and Cultural Rights, the Committee on the Rights of Persons with Disabilities, numerous special procedures mandated, including the Special Rapporteur on Health, Special Rapporteur on Torture, as well as regional bodies, including the African Commission on Human and People's Rights, the Inter-American Commission on Human Rights, and the Council of Europe, have called for urgent measures to address human rights violations against intersex persons. Numerous United Nations agencies, including the World Health Organization, OHCHR, UN Women, UNFPA, UNAIDS, UNICEF, and UNDP have likewise expressed concern and called for an end to these violations. Most urgent of all, and as already highlighted by Dr. Mofokeng and Morgan, is to prohibit and bring an end to violence and harmful practices on intersex children and adults, including medically unnecessary surgeries, hormonal treatments, and other procedures that attempt to forcibly change their bodies to be in line with societal expectations. These procedures are performed without the full, free, and informed consent of the persons concerned, are frequently irreversible, and cause lifelong pain, infertility, and severe trauma. International human rights law, based on existing standards, requires states to combat these abuses, to uphold the autonomy of intersex adults and children and their rights to health, to physical and mental integrity, to live free from violence and harmful practices, and their rights to health, and to be free from torture and ill treatment. Intersex children and adults should be the only ones who decide whether they wish to modify the appearance of their own bodies, and in the case of children, when they are old or mature enough to make an informed decisions for themselves in line with the Convention on the Rights of the Child. But many other violations have also been documented by UN human rights mechanisms. Infanticide and mutilation of intersex babies and infants, including as a result of accusations of witchcraft or based on societal norms around gender. Violence, insults, and harassment against intersex persons based on their appearance. Stigma, discrimination in healthcare, poor quality and denial of healthcare, violence in medical settings, lack of training of medical personnel, lack of respect for the dignity and rights of intersex persons, withholding of medical records, and medical classifications that treat intersex persons as ill. Obstacles to the modification of sex markers on official documents or records. Discrimination in other settings, including education, employment, and access to public services, with disproportionately high rates of intersex children who do not complete their education and higher rates of unemployment. Sports regulations that exclude women athletes with diverse sex characteristics. Lack of access to justice and remedy, as well as lack of attention to the root causes of these violations, including stigma and stereotypes about intersex persons. The note and our other publications go into a lot more detail, so I do encourage all in attendance to read the full background note and our fact sheets, which are available in all United Nations languages. I'll stop there.
Thank you very much, Michael. And it's so true what you say. These medical interventions, not only do they cause lifelong medical effects for intersex people, but they affect them everywhere, socially, economically. During the COVID pandemic, we did a survey on intersex people, and we found that more than 70% of the intersex community were unemployed and could not provide for themselves during the pandemic. And because of this is because of intersex people dropping out of school, because of being bullied, because their body is naturally developing a gender which was not chosen for them. And it's really sad that we're at risk of the medical community really trying to erase intersex people and their identities and causing lifelong mental health damages, physical health damages, and just intersex people isolating themselves from community because they feel that they don't belong in society. So thank you so much, Michael, for pointing that out. I'm going to move over to Tikli, and I would love to ask you, what are the main findings of the report that you wrote for the Ministry of Justice and the Ministry of Foreign Affairs on intersex human rights? Thank you.
Thank you, Crystal. And thank you very much for Finland and for ILGA for organizing this event and all the co-sponsors as well. The study titled No Information or Options, the study on the rights and experiences of intersex persons in Finland. It's available online and in English, thanks to the Ministry of Foreign Affairs. And it includes a lot of quotes and stories from intersex people and the parents of intersex children. And I will share some with you today, but I would encourage you all to go read those quotes and those stories. They're very profound and also distressing and very shocking descriptions of the kinds of experiences that intersex people and their parents live. The study that I conducted, the study data consists of interviews and online survey response from 12 intersex individuals aged 15 to 60, and 6 parents who had 7 intersex children. The children were born into 2000s and 2010s. The data and the participants are obviously not quantitatively representative sample of intersex people in Finland. The information cannot be generalized. However, as I said earlier, the views and experiences that people shared are very profound and informed descriptions of their experiences, and as such they're very unique and valuable. All the study participants, both intersex persons and their parents, they had experiences. Sorry, is my mic on?
Yes.
Can you?
Yeah.
Yes? Okay. Good. Thank you for checking, Kirsti. So all the study participants had experiences of various intersex-related medical interventions, such as examinations of sex characteristics, medications, surgical and other interventions. These interventions have typically started in the first few years of their lives, and for some people when they were teenagers. And all participants had both positive and negative experiences of healthcare. However, most of the experiences were negative. And there were 2 factors that determined whether a person's experience was positive or negative. First, whether the medical intervention that had taken place, whether it had been clearly vital for them and for their child's or for their own health. And second, whether the person in question was allowed to participate in the decision-making regarding the treatment. If the person had later found out that the treatment that they or their child went through was not actually vital, was not actually urgent, it could have been postponed, then the experience was mainly negative. These were often situations in which, rather than being involved in discussions related to the decision-making, intersex people and the parents had merely been informed of the interventions. For example, one parent recounted, and I quote, "After the sex of the child was decided, we were told about what they were going to do next to make the boy normal. They didn't actually say so much in so many words, but this was how their attitude came across to me. It was like, you have a son, but he's not normal or complete. That's why we're going to perform these surgeries to make him normal." There were also cases in which operations had been performed without even informing a teenage intersex person at all about the intervention that was going to take place. Or there were cases in which parents had been pressured to consent to surgeries, and the reasons that were given to them didn't have a clear relation to supporting the child's actual health. For example, parents had been told that it was necessary to perform an operation in order to avoid the child being bullied at school. Also, most intersex persons felt that they had not been allowed to participate in the decision-making regarding their own treatment. Obviously, for many of them, some operations, and many of the operations were done when they were still too young to say anything. However, by the time they were teenagers, and they theoretically could have had the opportunity to say no, many of them recounted that they had at that point already been subjected to multiple years of regularly examining their sex characteristics, going through different treatments. So even if they theoretically could have had the opportunity to say no, they didn't even regard it a possibility. These people's experiences were steeped in an atmosphere of no information and no options. Their fundamental experience was that they had not been given a chance to participate in the decision-making regarding their own body and their own health. The negative impacts that these medical interventions have had on people's lives were various. The impacts were worst for the people who had undergone involuntary and non-vital surgeries in their childhood. They described their experiences in terms of sexual violence and sexual abuse. People also reported different types of physical pains, problems with psychological well-being, feelings of secrecy and shame about their body and themselves. And almost all participants reported that their trust to the healthcare professionals nowadays is close to zero, and they avoid going to the doctor at all cost. One of the participants recounted, and I quote, "It was really horrible when the doctor examined my private parts with bare fingers and measured my breasts with a ruler. I was also taken to a psychologist and I had no idea why. As for making decisions, I was never asked anything at all." And I also want to point out what many of the participating parents described. They were themselves traumatized by the medical interventions that their children went through. They felt that they were not given comprehensive information, including non-medicalized informations on sex characteristics, and they were not properly explained the risks, and they were not given a chance to make an informed decision. And when they later on had learned that the operation that they had agreed upon was not vital, this had been a very traumatizing experience for the parents. And as I said, there were also positive experiences, a lot less than there were negative experiences. But these are important to share as well, because I think this is the reality towards which we need to be working towards. So positive experiences were related to situations where people felt that they had been met with respect, that the healthcare professionals had provided them with up-to-date information on treatments and their possible benefits and risks. And the parents and intersex individuals felt that they had made the decision themselves. The treatments had also been clearly necessary for their child's actual health, such as possible hormone treatment that they needed because of their variation. And with regard to non-vital interventions aiming to modify the sex characteristics of a person, intersex people recounted that they had positive experiences when these interventions had been performed based on their own full and informed consent, meaning when they themselves had asked for such treatment. So to sum it up, when the operations were vital and people had possibility to participate in the decision making, their experience was positive. And when they were non-vital and they did not have a possibility to participate in the decision making, their experience was negative. And important to note also that the majority of the participants, of the intersex people, they were adults at the point that I interviewed them. However, the parents' experiences are from the 2000s and 2010s, so the growing concern for the realization of rights of intersex children in the healthcare system is still very actual. Thank you.
Thank you very much, Tikli. I think definitely this report shows us that it's so important that we need to have stories about intersex people from intersex people. It's so important that we allow intersex people to actually hold and change the narrative that's out there about their lives. I think an intersex person is always the best person to speak about their lived realities. Hearing some of these stories, it's so relatable, and every intersex person can talk about the inhumane treatment they've received with the medical society. They can talk about feeling like you are an experiment, that all these tests that they have to run on you. And you can also feel that your bodily autonomy and self-determination being completely stripped away. I remember sitting in a room with my mother that speaks very little English and having a professor explain this disorder of sexual development to her, and all she said was, yes, because she did not have the words, she didn't understand the language, and unfortunately this is what people are dealing with out there at the intersex community and parents of intersex children. So I really thank you for sharing those stories with us. And what the positive thing is that intersex people deserve bodily autonomy and self-determination. We need to make decisions about our bodies. Thank you so much. We're going to move on to the next question that I would actually like to ask to all my panelists, but I will begin with Morgan. Morgan, given your national and international backgrounds, I would like to ask you, how do you believe the UN human rights system can play a role in promoting and protecting the right of intersex persons, as well as protect them from harmful practices?
Thank you very much, Crystal. I just want to say that the experiences that Tikli is describing are so similar to the reports that we have within Australia, that these experiences of a lack of bodily autonomy and the consequences of medical treatment without unnecessary medical treatment without personal informed consent are so profound and so pervasive, I think. And they're not just in high-income countries like Finland or Australia. These practices are the norm wherever medicine is accessible.
Yeah.
And medicine is accessible in most of the world. What can the UN system do? I mean, Michael has articulated something which I think is quite extraordinary, and that is that there has been a significant and consistent articulation of the human rights issues that are engaged by these medical practices and other forms of stigmatization and discrimination, almost from the get-go. So from the first statements by CEDAW and by the UN Special Rapporteur on torture, we've seen a very clear acknowledgement that medical treatment without personal informed consent to make people's bodies fit gender stereotypes or ideas about who we should be are abuses that need to be stopped. So I'm really grateful for the engagement of UN treaty bodies, of UN institutions, and particularly the work of the Office of the High Commissioner for Human Rights in making these really clear statements. And I think that they give member states a very clear agenda for action. What I think is sadly missing in most member states is any action to fulfill those human rights obligations. And I want to acknowledge that there are some countries that have acted to end human rights abuses in medical settings affecting people with intersex variations, including Malta as the first country to step forward, but also Portugal, Iceland, Greece, and I know that these issues are on the agenda in Finland, and I hope that we can in some point in the near future see action before the Parliament or in Parliament in Finland. I also know that there is a first jurisdiction in Australia that is moving forward with draft legislation. So hopefully we will see some action. But I want to thank the UN for setting the framework and providing such a clear and consistent voice to articulate those issues. So thank you.
Thank you, Morgan. Michael?
Thanks so much, Crystal. And Morgan, you already covered many of the points. I think really, the UN, the United Nations as a whole, and the United Nations human rights system is there to support states and all stakeholders in the promotion, protection, and fulfillment of human rights. And as Morgan says, we have seen some initial steps, so it is entirely possible. It is doable. These recommendations can be implemented, and they are being implemented in a small but I think growing number of states just in the past decade. I think as Morgan highlighted, the fact is it's still a small handful of countries. So 95% of UN member states there still are no measures at the moment to protect the human rights of intersex people. But I think that is what this meeting, that is what the attention of the Human Rights Council is all about, is about changing that and growing the number of states that take active measures. And we, the United Nations, have a role in supporting states in that journey, in working with intersex human rights offenders and organizations and stakeholders at national level to identify the key legislative measures, the policy measures that are necessary and that we know are possible, because we have some positive examples to move forward. And we're very much here, and we stand ready to provide that support at a technical level and otherwise to advance there. And I think, we're seeing, advances not just, in Europe. We know that, other measures have taken place elsewhere. In Uruguay, there have been some measures. We know that in the state of Tamil Nadu, in India, has also taken measures. And we also see how necessary research is to provide the evidence base for action at national level. And so the importance of carrying out studies and funding, because the intersex movement has very few resources. So the importance of states also supporting intersex organizations to do the research, to do the interviews and the documenting, to proceed with changes in policies and practices. Thank you.
Thank you, Michael. Tickly.
Thank you, Crystal. Yes, I agree with everything that Morgan and Michael already said. I think I want to touch upon the point on research and data. I think that is an area that I hope that the UN human rights system can also step forward. So, because I think one of the things that was really important in the study that I commissioned, it was conducted as part of the implementation of the National Action Plan on Fundamental and Human Rights, and as said, commissioned by the Ministry of Justice and Foreign Affairs. And why that is really important is that it defined the perspective of the study to that of human rights. And there's a multitude of research, medical research on intersex issues. And many of, for example, of my study participants, they said that in addition to going through the treatments in the different hospitals, they were also invited or compelled to participate in different medical research projects, which for them, if their experience of the treatments was negative, had been a sort of an additional re-traumatizing. So I really believe that we need more research and we need more data on the lived experiences of intersex people and their experiences in the healthcare system, but it has to be done from a human rights perspective. And I think that would be my call for the. Oh.
Thank you, Tickly.
Yeah.
Morgan.
Thank you, Tickly. I want to pick up on this point about data, because I think that one thing that I hear in government spaces is that they don't see any data on the harm or discrimination that is taking place. And that sometimes I do hear kind of vague suggestions that there should be more data. And I want to just comment that governments are not the only, or policymakers are not the only people to make those demands. I've heard clinicians say for 25, 30 years in peer-reviewed journals, call for more data before practices change. And I don't think we need more data before practices change. We know the human rights, the consequences for people of these human rights abuses in terms of impaired sexual function, sensation, lack of autonomy, and consequences to trauma. And I think that sometimes when people think that they want data, they're not actually looking in the right places. So when I look for data on human rights abuses, on people with intersex variations, I can talk with community members, I can talk with parents, I can also debate with clinicians, but I can also read what doctors write in medical journals about their practices. And, you know, you have to understand medical terminology and nomenclature and what the implications of some of these statements are. But there is actually a huge amount of data that's published, not only in Australia, but also in Finland, in India, in Latin America, around Europe, and actually around the world, in African countries as well, and in South Africa as well, about what doctors are doing. It's being able to interpret that data and make sense of it that is often the gap.
Thank you very much, Morgan, and I would really like to thank all my panelists, Morgan, Michael, and Tikli, for sharing your expertise with us and just really being open to this conversation and sharing your knowledge. I believe that it's a good start, right? We need to continue carrying on having these conversations so states can be held accountable and, you know, they can really see what's happening, the violations that the intersex community is facing. We're going to move on to some general comments from the audience, but I do believe that we have the ambassador of Australia that will be sharing some words with us. Can we move the table?
Well, I can move.
Yeah.
I can move as well.
Oh, you?
I'll just do it from here, shall I?
So you can be seen.
Yeah.
I'm really I'm not, is this working? I'm not 100% sure, but anyway, I can speak loudly. Firstly, I really just want to say what a great pleasure it is for Australia to be a co-sponsor of this event. It's been a really great thing to work with ILGA and Finland and Chile and other countries who have been involved to put on this side event. And I really want to thank the panellists and you, Crystal, all of whom have been really enlightening in your presentations, but also to thank you for your advocacy as well, because you know, without people like you prepared to come here and, you know, make these presentations, it's very hard for people like me, diplomats here in Geneva, to gain a greater understanding of the challenges that you face. And I really do want to acknowledge the work of the Office of the High Commissioner for Human Rights as well. And, you know, for me, it is encouraging that so much work has already been done to elaborate the rights of intersex persons, and the fact that we have so many special procedures also you know, taking a keen interest in the matter is also very good. In Australia, of course, you know, we have outlawed discrimination against people on the basis of intersex, but as you say, Morgan, there is still other things that could be done, and I'm very pleased to hear that one jurisdiction at least is moving hopefully forward in that respect. But I think there is more that we can be doing internationally as well. And you know, the Human Rights Council is one forum in which we will certainly be working with others to increase awareness and action on these issues, but also the universal periodic reviews, which all countries are subject to, are an opportunity to raise intersex issues in those dialogues. So that's something that we are committed to doing as well. So thank you very much, and I'll hand back to Crystal.
Thank you so much, Ambassador. Thank you so much. We'll be moving over to the representative of Netherlands. Ernst, hi.
Hi. Thank you so much. Thanks so much for having me here. Many thanks, Finland, ILGA, and all the other co-sponsors as well. Every time I'm at an event or a meeting that is related to the LGBTIQ+ community, there are always a lot of positive vibes, positive people, very interesting interaction and talks, and that despite the seriousness of the topic, I really, really like that, so it's really a pleasure to be here. Yeah, listening to all your very good stories and presentations, my major conclusion is basically that there's still a lot of work that needs to be done. And thank you also so much for sharing experience as an intersex person, because I'll just speak on behalf of myself, like as a cisgender male, a lot of these stories are, you don't hear them very often, so it's very good if you want to bring this topic forward that these experiences are being shared. It really, really helps us also in the important work that we are doing here. Very briefly on what we do as the Netherlands. As the biggest LGBTIQ+ donor in the world, we also try to support the intersex community worldwide, and also acknowledging that only 1% of the global LGBTIQ+ funding goes to intersex. So I think that's also some work that needs to be done on that front. And we do those projects mainly via our partners, HIVOS, COC, our Dutch LGBTIQ+ organization, and an ID, our Dutch intersex organization. They're not here, but they're probably listening online. And so we have various projects around the world, but also within the Netherlands. I think one of the panelists mentioned it as well, that also on national level still some work needs to be done. Also in Europe, for example, our parliament now is working on legislation to also prohibit non-consensual, non-medical treatment of intersex children. So even we are very active around the world. Also within our own borders, there's still work that needs to be done. I had a question to the panel. One of the examples of the projects that we fund is in Kenya. We supported the intersex community there, which has led to the establishment of an intersex task force within the Kenyan government. Intersex education is now part of the school curriculum as well. And I was curious to hear from the panelists or maybe other people in the room, what are other good practices or best practices that are shared? Like how can we bring this topic further around the world? Thank you again so much.
Thank you so much. Michael, would you like to have a go at the question?
Sure. I'll start with, I'm sure Morgan and Tikli will also have comments. Thanks so much, Ernst, for your question. There are, as I mentioned, an increasing number of good practices, and we're actually working on a fact sheet at the moment, detailing for each of the recommendations of the UN system in relation to the rights of intersex persons, key examples of where there are positive practices for each of those recommendations. And Morgan has already mentioned some of the states that have taken that have adopted legislation in this regard. So Greece, Malta, Portugal, Uruguay, Iceland, Tamil Nadu, and India, specifically around surgeries. But there are other states that have adopted measures in relation to non-discrimination, for example, South Africa and Australia. And again, in Kenya, there's been legislation adopted to uphold the dignity of intersex persons and also around discrimination. There have been studies in subnational level, in Switzerland, in Mexico City, in Delhi, in Colombia, research being carried out in Finland, of course, and many other jurisdictions. So there are examples of positive practice for each of these recommendations, and these are the ones that we know of, and I'm sure that there are others as well. So we very much agree that looking at these existing practices is important to inspire others. Do you want to?
Okay, thank you. Thank you for the question. I can share a few good practices from Finland. As of 2015, the Finnish Equality Act also explicitly includes intersex people and prohibits discrimination based on sex characteristics and obligates authorities, education providers and employers to prevent discrimination purposefully and systematically. And this has led to the Ministry of Social Affairs and Health providing a lot of and producing a lot of information material for different authorities on the diversity of sexes and diversity of the variations of sex characteristics. And at the moment, there's one positive example, an action that is implemented as part of the National Child Strategy. There's a national working group drafting a recommendation on how healthcare providers should provide initial and first information to parents when they learn about their child's variation of sex characteristics. And this recommendation, I think it will be published next year, but it is very crucial because the information that parents receive has a huge impact on how they relate to their child and what kind of decisions they make.
Thank you. Just a couple of brief comments to add to what's already been said. I mean, I think that there is work that international institutions and that member states together can collectively do to advance the human rights of people with intersex variations. And I think that one of those, I think, is to move forward from statements at the Human Rights Council to a resolution at the Human Rights Council, and to consider doing that maybe next year at some point, and resolve to seek a report from the OHCHR on these issues to help further understand the actions that member states can take. I think also there's a need for significant reform in healthcare and in medicine. And of course, the World Health Assembly is a space where member states play a key role in governing healthcare and medicine. So the situation right now is that, is to pick up actually also on the point about data. I mean, data is not just about personal stories and experiences of individuals and families. Data also appears in classifications in the International Classification of Diseases. And in many countries, data also appears in reimbursement codes for medical procedures. So these are areas that you can look at both domestically and internationally to make sure that medicine is respecting the human rights of people with intersex variations. And I believe that requires reform to the International Classification of Diseases to make sure that it's in conformance. And I think that there's work that member states can do to encourage the World Health Organization to itself investigate these issues and make sure that medical practices align with the human rights norms that have been so clearly expressed by the human rights system.
Thank you very much to all of my panelists. We are now going to hand it over to the floor. We have an opportunity for 2 questions. So if I can see 2 hands, I acknowledge your hand. Okay, we'll allow the question from South Africa as well. So we will allow 3 questions and then our panelists will answer them all in one go. Is that good?
But thank you very much for the presentations. It has been really, really interesting. I'm Brian Franker from the Foreign Ministry of Israel. I'm very happy that we're discussing this here, even outside of the council these days. We're spending so much time here. So really thankful for that. I retain 2 key concepts that you highlighted many times, this idea of dignity and bodily autonomy, and I think that it's very important. My colleagues here were fighting for these concepts in all the resolutions, so it's very good to know that that's what we have to keep doing. I just wanted to share based on what you said. I'm happy to, I was checking my notes, and I'm happy to say that Israel in this regard seems to be doing things more or less okay. So the Ministry of Health has recently issued a directive referring to intersex people, including children. And the key principles there are the informed consent and the respect for the will of the person. So some of the points that I think relates to what you presented today is that no medical procedure will be done if the child, in the case of children, protests to it. And in the case of irreversible surgery procedures that are not urgent, first they will determine what is the will of the child. They cannot do it directly only with the parents' permission. So I think that seems to be in line to what you have expressed so far. And the gender identity of the child will also be determined considering the level of the understanding of the child. So it's not going to be the doctor who determines that. It's going to be based on conversations with the child and respecting their will. And it also recognizes the possibility for the child to reject any treatment, including hormonal treatments. So probably there are a ton of things that you can tell us that Israel still needs to work and do, but happy to see that at least some of those principles here are reflected. So I just wanted to share it here as well as something good happening around. Thank you.
Thank you. Thank you so very much. My name is Kirsti from the South African Criminal Mission. And this has been a very interesting conversation. And just building on moving from rhetoric to reality, maybe on the work that has already been done in the Council. You might remember in 2019, South Africa presented a resolution within the Council on the discrimination, especially on women and girls in sports. And the IHRA presented a really incredible report that really touched on the intersectionality. And that was also very much influenced by a really lived reality of Caster Semenya within the country. So, and to bring those issues to the international flora. So with that being said, I also just want to know maybe from the panelists, how best as and within our own national interests, how do we start the conversation and bridging those gaps? Because I think on the education element, we're still very much lacking in really bringing these conversations to the fore. I mean, in the South African context, we've got comprehensive sexual education, but maybe not to the extent that speaks to really going to understanding the concept of intersex persons or whatever the case might be. Because the laws are there, they're incredible, but maybe bridging those and really making them a reality for South Africans, or maybe even in other countries. So that would be interesting to hear. Thanks.
Good morning, my name is Yvonne Apio Brently Amolo. I'm both Kenyan and Swiss. I'm a member of parliament here in Switzerland, but I'm going to be speaking about Kenya because I was really pleased to hear about all the developments that have happened. And my question actually is just an extension of her question as well, because I was going to ask, it is really good to hear, and I have known about the task force for intersexual people in Kenya since 2017. But what is happening in Kenya, what is on paper and what is on practice, the reality are really two different things. Because just on 26th of this month, there was a ban from the Kenyan Film Cooperative Board or something like that, KFCB, on films that show anything to do with the LGBTQIA+ group. And that means I know only two. One is I Am Samuel, the other one is Rafiki. They have been completely banned. So for people who belong to this community, if you don't see yourself represented, how the hell can you actually come out and say this is what is affecting you? How the hell can you speak about what you can do medically and socially on such things? And the other thing I was going to say is also in 2019 they banned an NGO that represents the LGBTQIA+ group from being registered. So we see that what is on paper and what is actually being practiced are two different things. So how can we really solve this? Thank you.
Thank you so much for all of the questions. I'm going to hand over to my panelist, Morgan.
Thank you very much for the really thoughtful questions. Yvonne, picking up on your question, it's my experience that there is very uneven development in terms, not between global north and global south on this issue. There is leadership in parts of the global south on this issue, including positive action in Kenya. But I think there's uneven development when we think about the progress for the populations that we put into the acronym LGBTI. And while in Kenya there's been more action on the human rights of people with intersex variations, and there is still a lot of work, basic fundamental work that needs to take place for LGBT people. I think in many regions the reverse is true, where particularly in some high-income countries there has been a lot of attention to the needs of gay men, lesbians, and also trans people, and no attention to the needs of intersex people. So that's really what I mean by uneven development. And I would like to see a much more even development and attention to each of the specific needs of the specific populations that addresses all of our needs. And I think that this also speaks to some of the other comments that are made. So, I mean, I'm a cisgender man, and I have a history of medicalization because my body hasn't conformed to ideas about about how a male body should appear and function. That's not about my identity. It's about my body, and I want to make sure that you are really all aware that actions and policies that you might have to address the needs of marginalized people with marginalized identities does not necessarily have any impact on people with stigmatized bodies. And I want to kind of draw attention to the need for you to give specific attention to the needs of people with stigmatized bodies. I also want to say, I mean, one of the best things that countries can do to move forward is to take action and seek to become a role model on these issues. And I'm really pleased to hear that there is work in Israel on guidelines. I know from the work that we've done in Australia, and particularly the report of our IHRA that produced a major report last year with significant recommendations. The findings in Australia are that guidelines are inadequate. We know that even for high burden childhood illnesses, that guidelines are often not followed by clinicians. And guidelines are, they're guidelines, they're not mandatory by definition. So our IHRA has called for criminal sanction, has called for legislation and the criminalization of unnecessary treatment, and definition of what is medically necessary. Real clarity about these issues. And I think that I would like to see countries seeking to become leaders on this issue and working with community to secure law reform that will actually achieve constructive objectives. Thank you.
Thank you, Morgan. Michael?
Okay. Thanks so much. Just to follow up on Morgan's comments, it would be great to hear more about the directive of the Ministry of Health in Israel. We're always keen to hear about developments at national and regional level. So that would be really great to hear more about. While at the same time, echoing Morgan in terms of that the recommendations based on the practice that we've observed at national level are that legislative measures are necessary to affect change, but it's not legislation alone will not achieve, but it is necessary as part of the package of measures. I want to absolutely acknowledge the representative of South Africa. We've both the office and also the human rights mechanism have paid significant attention to discrimination and harmful practices in the world of sport that specifically target women with diverse sex characteristics, and have engaged specifically on the case of Caster Semenya. So it is an issue that's to which we pay close attention, and we're continuing to follow as it develops. In terms of how to bridge the gap, I would just really like to echo Morgan. We've seen states collaborate with intersex organizations at national level, at regional level, to set an agenda for change. I think the recommendations coming from the UN system provide a roadmap, specific action points around harmful practices, around other issues of discrimination. And it's really where we've seen this collaboration between the intersex movement and states at national level that we've seen the most positive developments. Sometimes we've seen states that have taken measures slightly, not necessarily in close collaboration with the intersex community, sometimes with unintended outcomes that don't necessarily address the major issues. So I really think that collaboration with intersex human rights defenders is a key first step, and that's where we've seen really positive results. So maybe I'll leave it there.
Thank you, Michael. Deeply.
Thank you. Yes, I definitely agree with Morgan and Michael on the need for legislation that prohibit these non-vital medical interventions. I would also like to, I think one of the ways to move forward is also pay attention to child's rights and the way the best interest of the child is defined when making decisions. We need to find ways to develop practices to assess and document how the child's best interest is defined when decisions are made. And I think I want to share a few thoughts that my study participants pointed out. They said that when it comes to children, intersex children, we need to understand that it is the duty of the adults to create the space in which a child can learn to know themselves, know their own body, and learn to value and appreciate and love themselves as they are. And that is the duty of the adults. And another thought that I want to share, which is from the youngest participant of the study, Carolina, who was 15 years old. She had not undergone any medical interventions that would have altered her sex characteristics because her parents had said no and had protected her. And she said that we need to change the story and the wrong understanding that as if learning about you being intersex would always be in a negative experience. Carolina said, I don't remember if my parents used the word intersex, but they told me about the bodily variation that I have. And it was in no way unusual. I have never been pigeonholed by sex or gender. I've always just been myself. So perhaps the knowledge of me having a variation of sex characteristics, maybe it just made me stronger.
Thank you so much. I would really like to thank everyone for the questions and our panel for really engaging with the questions. Like the 2030 agenda says, leave no one behind. And I believe that we should end with knowing that when you are having conversations, always think about intersex people. Their development matters. Intersex rights are human rights. And intersex people just need to exist and be themselves. I would like to thank the organizers, the Permanent Mission of Finland, as well as ILGA World. I would also like to thank the co-organizers, Argentina, Australia, Austria, Chile, Iceland, India, Mexico, the Netherlands. And I would like to thank GATE, Intersex Asia, Intersex Human Rights of Australia, OI Europe, and as well as Iranti. And thank you all for coming today, and for those online, thank you so much. And remember, intersex rights are human rights. Thank you, everyone.